Hi guys, today I will be explaining scapula and shoulder joints, anatomy and biomechanics. I have invited Maheen to join me in this presentation. Maheen is a senior physiotherapist and her IG address is at the bottom of the screen. She will be talking about the anatomy of the shoulder blades and shoulder joints, and later I will give you exercises that will help strengthen those muscles surrounding these areas.
Hi everyone, my name is Maheen. I'm a physiotherapist from London, living here in Singapore for the past 8 years. Thank you, Tisha, for having me on your channel today. We wanted to do a short video on the shoulder today, so we'll go through some of the anatomy to give you a better understanding of the shoulder, and then we'll go through some common injuries. After that, Tisha will go through some exercises that can help with keeping your shoulder nice and strong. So let's get started. All right. When people talk about the shoulder joint normally, they're probably talking about the glenohumeral joint, which is this one here. But the shoulder complex is more than just your glenohumeral joint. The shoulder is quite fascinating. It is made up of 4 joints. The glenohumeral joint, which is this ball and socket joint, and it's one of the most mobile joints of the human body. Next we have the sternoclavicular joint, which is where this breastbone meets your clavicle, your collarbone. And then we have the acromioclavicular joint, which is the AC joint, right on top of your shoulder here. And finally we have the scapulothoracic joint, which is here, where the shoulder blade sits on your rib cage. The shoulder has a lot of degrees of movement. While this is great for allowing us to do things with our arm, but unfortunately also predisposes the shoulder to lots of injuries. But the good thing is that we have lots of structures in place that help to stabilize the shoulder and prevent it from getting injured. We have some static stabilizing structures and some dynamic stabilizing structures that allow us to move in multiple planes of the body and allow us to use it in our day-to-day life or even when playing sport. So when there is wear and tear or injuries to these stabilizing structures, the stability and the function of the shoulder is compromised. So let's talk about the static structures first. They are the structures in place that help to hold everything together in place nicely. Firstly, we have the labrum, which is like a rim of cartilage that helps to deepen the socket so the ball can sit nicely inside the socket. And it also acts as a little suction cup that holds the joint in place. The labrum can tear when you have a shoulder dislocation, usually from a direct blow to the shoulder. So when this structure is no longer doing its job properly, it leads to shoulder instability or risks of repetitive dislocations. The degree of tear would usually determine whether you would need surgery or whether you could manage this conservatively with physiotherapy. So what happens when one structure fails? We look into basically using other structures that help with the overall function of the shoulder. So for example, if the labrum is not doing its job properly in stabilizing the shoulder, we can hope to rely on our muscles to help us with the stability instead. So we also have ligaments that hold the bones in the right places, also a static stabilizing structure. And again, if you have an injury and that tears your ligaments, then that can also lead to instability. A common ligament injury could be on the AC joint here. What happens is you normally see a little bump on top of the shoulder here. That's because the ligaments are no longer holding the bones together in the right place, so the bones move from the original position, hence seeing a little bump on top of the shoulder here. Next, we have the dynamic stabilizing structures, which are basically your muscles. We have the rotator cuff muscles, which are a group of 4 muscles that come out of the shoulder blade and then into the joint. And we also have the long head of the bicep tendon, travels from up here, then goes into the joint, helps to hold the head of the humerus down. And we also have the surrounding shoulder blade muscles. These muscles or the tendons can be injured with repetitive overhead actions from sports like tennis, swimming, or they could be damaged from a fall, or if you lift something that is too heavy in an awkward position, that can also lead to damage to these structures. Some muscle imbalances can also lead to certain structures working too hard. If the ones that are supposed to be doing their jobs don't do their job properly, for example, or if the ones that help with the smooth operation of the shoulder structures don't anymore, then we can get some structures that become pinched along the way, or the ones that working too hard can be painful and inflamed. So in summary, the shoulder joint moves a lot, but we have things in place that help to stabilize it and help with effective functioning of the shoulder. When we have a part that does not work properly or do its job properly, this can then affect how the shoulder functions and moves. This can lead to other structures being overloaded and being inflamed, or in more serious cases, weakness if there's a tear, or causing more complication. These things are treatable. If you suspect an injury or experience pain, then you should see a professional that can help you out as well. Otherwise, that's all from me, and Tisha will take over from here and take you through some exercises that can maintain your shoulder health. Thank you for your time. Bye.
So thank you, Maheen, for a great introduction of the scapular and shoulder joint. Okay, so the next video, I will be presenting exercises that help stabilize muscles surrounding your shoulder blades and your shoulder joints. So if you have any questions, please write me and I'll be happy to answer your questions. So, as mentioned, we need to strengthen muscles surrounding your shoulder blades. So to have a proper form of biomechanics of your scapular movements. Okay, so one of the exercises to strengthen your middle trapezius and lower trapezius are using flex band. So I'm going to show one of the exercises to strengthen middle trapezius. So tie a flex band to maybe a doorknob, or if you have a bar like this, you can tie a flex band around your shoulder height. Okay. From there, you're going to step out and then make sure that you have a little bit of resistance on the flex band to start. Reach your arms long forward. Inhale here. As you exhale, think about reaching your elbows slightly straight back without squeezing the shoulder blades behind your back. Inhale, slowly return. We go again. Exhale. Think about the middle part of your scapular muscles is pulling your arms backward. And return. We go again. Then make sure that you are using evenly on both sides of the muscles of the back here, or middle of trapezius. As in strengthen these muscles is important to keeping your scapula in a very healthy alignment. Okay, the next one is to strengthen your lower trapezius, which is the muscles at the lower part of your ribcage here. So you will need to try to tie your flex band over your your door at the highest point of your bar, maybe doorknob, and close the door tightly. From here, hold a flex band with your arms long. When you exhale, think about bring your elbows down and back. So now we target lower muscle fiber of your trapezius, down and back. And again, exhale, down and back. Okay, reach your elbows down in line with your flex band. So try not to let the shoulder comes up to the ears. Think about slide the shoulder blades down before you pull your arms down and back. Okay, so do these exercises 8 to 10 times, maybe 3 sets. Once in a while, that would be good for your middle and lower trapezius. Okay, then the next exercise, we want to talk about your rhomboid muscles, right? Muscles in between the shoulder blades that is responsible to retract your scapula. We also need to strengthen that muscles, okay? So what you do is, it is quite similar to your middle trapeze, but this time you will squeeze the shoulder blades together, okay? So it's the same exercise rowing, but this time as you bend your elbows back, squeeze the shoulder blades toward each other. This is strengthening muscles in between the shoulder blades, your rhomboid muscles. Squeeze and reach. We go again. Squeeze for each other. So visualize there's a pencil in between the shoulder blades, and you squeeze as pencils in between the shoulder blades. And one more time. So remember, every exercise you have intention. Okay, so this one you want to squeeze the shoulder blades together to strengthen these muscles in between the shoulder blades. Okay, so next we are going to talk about how to strengthen your lats muscles, okay, together with teres major. As Maheen has mentioned, it is important to strengthen muscles surrounding this shoulder blade, okay? So how do you strengthen this lat muscle? So your lats and teres major are part of the muscles that help moving your arms behind, extending the shoulders, okay? In order to do that, okay, we are going to do an exercise of shoulder extension. So I have my flex band again, wrap around a bar. You can use a doorknob. Your band should be around your shoulder height or slightly lower. From here, you stand facing the band. Hold on to each side of the band. Okay, so I'm going to take a deep breath in. As you exhale, think about slide the shoulder blades down slightly and pull the band so your arms pass behind your hips. Inhale to return. Keep going a few more times. I want you to do maybe 8 to 10 repetitions. Try to keep your arms long. Okay, so try not to bend your elbows. If you're bending your elbows, then the target muscles will be your triceps rather than your lats and your teres major. You can do one side, okay? Maybe you can have your hands guiding your lats here. You should feel this muscle sliding down and back as you work this exercise. I can feel that my lats are engaged here, a little bit taut here. And then move it back. You can do 2 arms at a time to start, and then start with unilateral to strengthen further. Now that we have discussed about muscles as responsible for surrounding your shoulder blades on the back and on the side of the muscles, we're going to be talking about muscles that are responsible for upward and downward rotation of the scapula. So these muscles are pretty much the same as similar as your retraction and depression. They work together to move your scapula up in upward rotation and downward rotation here. Okay, so the exercise that I like to do is called Snow Angel. So you hook your flex band again at the top of your door. Okay, so it should be higher than your shoulder height. Then reach your arms up to the side. Okay, your arms slightly in front of the shoulders. Okay, this is your start position. Your scapulas are already in an upward rotated position. When you exhale, you pull the strap down by your hips. So now your downward rotator of your scapulas are working to move your scapula back down to neutral. And then here, try to control the upward rotation using the eccentric contraction of the downward rotators to control. And we go again. Downward rotation of the scapula. Upward rotation of the scapula. Control the ascending. And exhale, pull down against the resistance of the band and control the return. So it goes slowly into upward rotation and pull it down. Very good. So here your rhomboid, your pec, your lats working together to bring your scapula back down. So the next exercise, we will be focusing on serratus anterior, okay, muscles like banana shape underneath your armpit here. So this muscles is very important to help keep your scapula in a neutral position, so your scapula doesn't stick out into a winging position. Okay, one way to strengthen these muscles is to try to, memorize the sensation of how this muscles is being activated. So to begin, I start to stand facing a wall. I have my arms shoulder height. Make sure that my arms are straight, not bent. Okay, from here, maintain neutral position of the spine. I take a deep breath in. When I exhale, I use these muscles to feel like I'm pushing my hands so that I push the wall away from my chest. Okay, inhale here. Exhale, I press my hands into the wall really hard. Visualize I'm like a Kung Fu Panda pushing the wall away from my chest. So try to do this 8 to 10 repetitions. Exhale, push your hands into the wall, sending the wall away from the chest. You should start to feel the muscles underneath your armpit starts to activate there, a little bit of sensation of tightening. Of course, your pec will kick in as well. Okay, the way to find out, maybe you just do one arm and have one of your hands here try to dig into your muscles on your serratus anterior here. Now, as you do one arm, push the wall away. See you feel it, whether this muscles has been activated or slightly taut. And then release a little bit. And we go again, push. I can feel these muscles tightening here. Release. One more time, push. And then release. Rotator cuff muscles are a group of muscles, a group of 4 muscles that are important to help stabilize the glenohumeral joint. In other words, it helps stabilize your head of the humerus inside of the sockets. The 4 muscles are supraspinatus, infraspinatus, teres minor, and subscapularis. So here in this mannequin, I'm going to break down each of this muscle for so you can have a look in details. First, infraspinatus. So your infraspinatus is attaching from the fossa of your infraspinous fossa to insert into greater tubercle or outside arm of your humerus. Okay, the action of the arms is to external rotation of the arms. Okay, and next we are going to have a look at supraspinatus. So supraspinatus origin is on the supraspinous fossa of the scapula, top of your scapula, and also insert into greater tubercle of your humerus outside top of your arm. Okay, the action is to help lifting the arms out to the side, abduction of the arms. Next, we are going to look at teres minor. Okay, so teres minor is a very tiny muscle above teres major. Okay, 2/3 of the lateral or outside origin is 2/3 of the lateral border of your scapula, and then insert into greater tubercle of the humerus. Okay, the action is to external rotation of the shoulder and adduction of the shoulder joint. Last but not least is subscapularis. Okay, let me show it to you here. Subscapularis origin is in the subscapular fossa of the scapula, meaning it is attached to inner side anterior portion of your scapula and insert into lesser tubercle of the humerus in front of the top of the arms. The action is to internal rotation, help internal rotation of the shoulder and help latissima dorsi and teres major in extension of the shoulder joint. Now we are going to cover muscles that help to stabilize your shoulder joint, glenohumeral joint. Okay, these are muscles that are controlling the movements rather than initiate the movements. Okay, so the rotator cuff muscles are important to keep your shoulder joints healthy, working together with scapular stabilizer muscles. Okay, one of the exercises that I like to do is 4 exercises that I will focus on: external rotation, internal rotation, abduction, and adduction. Okay, so I tied my flex band around a doorknob of my room, and I made sure that the flex band has a little bit of give here. So first, I'm going to show you internal rotation. So I use the same arm that is closer to the flex band. I have my elbows close to my body. Bend my elbows 90 degrees. When I exhale, I pull onto the flex band. So my forearms move across center of my body, and then I slowly return. So I'm working this internal rotation of the shoulder joint of my left arms as I slowly release. Okay, so try not to let your elbow lift out to the side as you move your forearms towards the center of the body. Okay, and I would like you to also pay attention as you return. Try not to let the flex band bring your back swiftly like that. So you want to control the return as the same as you use the same pace as you internal rotate your shoulder joint, and with control, return. Okay, so you should feel here top of the shoulder joints working and slowly return. Good. Then the next exercise, we are going to focus on external rotation. So if you want to use the same arms, then you will rotate to the other side. So we're going to use the arms that is further away from the flex band because I want to show you facing you. So we're going to switch arm. Okay, this time we're going to work on the outside arms away from the flex band. Your start position looks similar. Elbows bent toward 90 degrees, arms by your side. So visualize you hold a piece of paper here. This time, as you move out, you resist the resistance. And then with control, slowly return. So your shoulder joint is going to external rotation here. Return. So you might want to notice that the line of the flex band is straight line as I pull in and out. Okay. I resist the resistance as I pull away, external, and then I resist as I return to start position. A few more times. And one last time, use your breath. Okay, you should feel back of the shoulder joints working here. Okay, next one we are going to do abduction. Okay, this muscles is also a part of your rotator cuff muscles. From here, I'm going to use my right arm. I'm going whole flex band as if I'm rubbing my belly, elbow reaching out towards opposite wall. When I exhale, I'm thinking about nudging my neighbor with my elbows. Inhale, slowly return. So I move my arm or my hand across my tummy. So I'm not lifting my shoulders up. I'm just moving my shoulder joint away from the center of my body. Abduction. Okay, exhale. Slowly return. One more time. And slowly return. Next one, we are going to do a deduction. Okay, so I'm going to work my left side so that I can face you. Same thing, I want you to bend your elbows out to the wall, 90-degree elbow joint. This time you're going to rub your bellies towards the opposite hips. Move in towards the center of the body. A deduction. Inhale. And one more. Okay. If you want to progress, you can work your horizontal abduction or adduction. So this is going to be a little bit harder as a progression of abduction here and adduction here. This time you lift your arms shoulder height. And as you exhale, move your arms away from the center of the chest. So this is horizontal abduction because you lift your arms parallel with the floor. So you're already in your flexion of the shoulder joint as you move your arms away. This is another good way to strengthen the muscles here. Same goal for a horizontal adduction. You move your arms towards the center. Keep your arms long. Okay,